As a young child, I saw my father as a volunteer firefighter and as one of the first EMTs in the United States, and saw that example, and it's something that always drew me to public safety. We have come so far in my career in communications. We've got a generation of folks coming into the workforce now that computers was always a part of their life. So they're looking to maintain the degree of normalcy and having the ability to be connected, and most importantly, to use that connectivity to find answers to questions. Whether it's directions to a call or looking up a new medication they've never heard of before to see what it is, they expect to have that in the palm of their hand and be able to use it and access that information on a moment's notice. I'm glad at this point in my life that I have the time to basically start another career with the FirstNet Authority and take what I know and what I've learned, and more importantly, help foster the spirit that we had 10 years ago for the next 10 years of not what would this network look like, but what can we now do with this network. We can be creative, and that there are solutions, in particular the use of the FirstNet Authority and the available technologies to take what we started and expand upon it much more in the next few years. The onus on us now is to how do we not only improve upon the information sharing that we have, but find new, unique, innovative ways to make that more automated, to make it more seamless, and more importantly, to make it more real-time, just-in-time right now. When going to the hospital isn't a ride down the road. Going to the hospital is having to be transported 2 or 3 hours away. When you're working in EMS in a rural area, you're really sort of out there on your own, you and your partner. FirstNet gives us the ability to open up the entire world of healthcare experience and knowledge and bring that to that patient in that rural setting. Telehealth gave us the opportunity to bring that physician to that patient, to make the right decisions on their care and their disposition. And we prove that not just does the system work, but the technology works. Field level folks would come up with really good ideas that would quickly get squandered because we didn't have the ability to do that. A lot of those ideas were based upon connectivity and communication and information sharing and being able to access information that we need right now. We have a solution in place that no longer makes that a barrier to effective communications in the field. I want to be that conduit that when somebody has a problem, somebody has an idea for a solution, and then get them with the people that are the engineers, the solution builders, and make that happen.